A 2-year-old female child was brought to primary healthcare center with complaints of cough and fever for the past 2 days. On examination, the child weighed 11 kg, respiratory rate was 30 per minute, and chest withdrawing was present. The most appropriate line of management for this patient is to answer classify as pneumonia and referred urgently to secondary level hospital. False answer, classify as pneumonia, start antibiotic and advise to report after 2 days. Classify as severe pneumonia, start antibiotic and refer urgently. Classify as severe pneumonia and refer urgently. Classify as very severe disease and refer urgently. A study was conducted in selected rural area reported birth asphyxia, low birth weight, and neonatal sepsis as the main cause of neonatal death. Which of the study design is more feasible to find out the study? To answer, longitudinal study. Study was conducted in selected rural area reported birth asphyxia, low birth weight, and neonatal sepsis as the main causes of neonatal death. Which of the study design is more feasible to find out the study? To answer, longitudinal study. False answer, cross sectional study, case control study, cohort study, retrospective cohort study. As a researcher, you want to conduct an analytical study to assess the association between passive smoking and migraine. What will be the most appropriate design for this analytical study? To answer, case control study. False answer, comparative cross sectional study, cohort study, ecological study, nested case control study. A chemical or heavy metal that is hazardous to human health does not constitute risk unless there is exposure. For determination of such risk, some element must be considered. Which one is the most important element in such risk assessment? To answer, probability of exposure. False answer, hazard resilience, vulnerability, probability of adverse consequences. Every year throughout the world, millions of industrial accidents occur. Some of them are fatal, and some of them result in permanent or temporary disablement. Working in an industry may cause different types of accidents. What is the most common cause of these accidents? To answer, poor ergonomics. False answer, misuse of equipment, manual handling of heavy load, inadequate safety training, weak structure. An ecosystem includes living organisms in a specified physical environment. The multitude of interactions between the organism and the non-biological factors in the physical environment, such as air, water, minerals, and temperature, that limit their growth and reproduction. What is the most cranial component of an ecosystem? True answer, hydrosphere. False answer, symbiosis, parasitism, mutualism, predation. Substances which are non-digestible, no starch polysaccharide derived from plant source. Excess intake may cause malabsorption of trace elements. They help to reduce body weight and prevent risk of obesity. Which food considered with this feature? True answer, dietary fiber. False answer, vitamin, vegetable, mineral, water. Essential nutrients are required in a small quantity. These are not usually synthesized but may be synthesized inadequately in the body, so they must be supported in diet. What is the name of this essential nutrient? True answer, amino acid. False answer, glucose, vitamin, mineral, fatty acid. Over the last century, a remarkable change like increasing middle-aged population and decreasing young population have occurred in the age structure of the population worldwide. What is the main reason responsible for this change? To answer, reduction in fertility. False answer, modern and updated medical care services, provision of optimal care to old patients, provision of screening of disease, vaccination against infectious disease. False answer, modern and updated medical care services, provision of optimal care to older patients, provision of screening of disease, vaccination against infectious disease. Human excreta of a sick person or a carrier of a disease is the main source of infection that transmits a new host through various channels. What is the which is the most effective measure to break excreta borne disease transmission? To answer: segregation of feces. False answer: control of flies, maintenance of personal hygiene, protection of food, protection of water supplies. A 4-year-old baby having clinical features of liver enlargement, edema with high pigmentation of skin. His serum albumin concentration is 3 gram per deciliter. He needs to have high protein containing food to overcome this problem. Which is the highest protein containing food? Gram per 100 gram. True answer: soybean. False answer: egg, fish, meat, pulses. Healthcare associated infection are infections that occur while receiving healthcare developed in a hospital that has appeared 48 hours or more after hospital admission or within 30 days after having received healthcare. The term ACAI covers a wide range of infection. Which type of infection is included in ACAI? True answer: urinary tract infection. False answer: bacteria, 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 central line associated blood stream infection, gastrointestinal infection, skin infection. Common ACAI: surgical site infection, pneumonia, urinary tract infection, bloodstream infection, gastroenteritis. Snake bite is a neglected public health issue in tropical and subtropical countries. Rural community people should be given health education to tackle this problem. Which is the most important health education that should be given regarding management of a snake bite? To answer: reassurance of patient that 70% snake bites are non-venomous. False answer: do not give alcoholic beverages to patient. Immobilization of affected limb, removed of clothing or ornaments that constricts beaten limb, transport the patient to a medical facility after giving first aid. Recently, World Health Organization Recently, World Health Organization has offered some training and research programs on tropical diseases for all the regional countries. The aim of the programs is to strengthen the prevention activities among the countries where disease tropical will be mostly targeted for research and training. True answer: tuberculosis and AIDS. False answer: tuberculosis and dengue fever, malaria and dengue fever, leprosy and Kala-Azar, malaria and filarial. Globalization has multi-dimensional effects on health. Health market is a leading market in this era of globalization. Different type of health markets are existing throughout the world based on agreements of the World Trade Organization WTO, in which agree of WTO health services are dealt. To answer: technical barriers to trade. False answer: general agreement on tariff and trade, GATT. Trade related aspects of intellectual property rights, TRIPS. General agreement on trade in service, GATS. General agreement on health trade, GAHT. Dengue fever has re-emerged with higher morbidity and mortality in this year of Bangladesh. As a public health specialist, you intend to identify the climatic factor associated with the rising threat of dengue fever in Bangladesh. Which climatic factor will you emphasize most? To answer: precipitation. False answer: temperature, humidity, wind flow, calamity. A cyclone strikes a upazila of Bangladesh. It has destroyed all communications system including radio, television, newspaper and mobile network. Which will be the best way to best way of disaster risk communication? Which will be the best way of disaster risk communication with Directorate General of Health Services, DHGS Bangladesh? To answer: miking. False answer: press release, messenger, Roundtable meeting forecasting. In a rural community of Bangladesh, high school adolescents are suffering from frequent attacks of diarrhea. To prevent this problem, awareness building intervention of personal hygiene is essential for the adolescent, which will be the best role of a community physician to conduct this awareness building intervention for the rural school adolescents. To answer teacher, false answer, trainer, educator, facilitator, demonstrator. A study in Dhaka city revealed high prevalence of hepatitis B virus infection among intravenous drug users. The Ministry of Health and Family Welfare of Bangladesh has asked to identify the persistent carrier state among the IDUs. To identify the carrier state, the ideal period of duration of presence of HBsAg in blood will be longer than true answer 6 months, false answer 3 months, 9 months, 1 year, 5 year. The government of Bangladesh intends to implement health insurance policy of Bangladesh. The policy makers are worried about some problems with health insurance. Which one is the most common client selected problem? True answer, moral hazard. False answer, adverse selection, deductible, co-insurance, limit in payout.